It's to highlight the stresses, the challenges, the existence of mental health problems in the youth population, and to highlight what the Ministry of Health, basically, and other stakeholders are doing to address this particular issue.
Is it a situation where the young people, it, it, it's taken for granted the stressors that young people go through, and that the mental well-being of young people is not seen as a priority?
Well, it's probably because our focus has been diverted to other issues. Like we talk a lot about NCDs, diabetes, hypertension, cancer, dialysis, and so on. And we tend to forget the hidden problems. And we tend to forget that young people, especially as they're transitioning from childhood to adulthood, because of the physiological and anatomical changes that they go through, really affects their psyche and affects and makes them quite a vulnerable group. They're also a group that's, especially in this day and age, exposed through social media to a lot of negative influences. Well, we have a whole group of psychiatric nurse practitioners out there. We work with the Ministry of Education closely. We established a network with the Ministry of Education. And our basically health facilities are probably not every facility has as trained personnel as we would want, but they're trained to try to identify some of these issues and then refer to psychiatric nurse practitioners. We're right now focusing on a health plan, adolescent health plan, that will address some of their priority concerns, which includes violence, drug use, and mental health as a general issue. So we're focusing a lot more on this particular vulnerable population and trying to get additional human resources to provide the necessary services.